The following video will focus on best practices for taking an accurate blood pressure reading while using the Connex Vital Signs Monitor. The patient should be seated and at resting state. When applying the cuff to the patient's arm, use the range indicator on the cuff to determine the proper size. If two cuff sizes fit the patient, use the larger one. Cuff sizing is based on the circumference of the patient's arm. To determine proper fit, the brachial artery marker should fall within the range indicator. Shown here are two blood pressure cuffs, sizes 11 and 12, as an example. It is important to point out that inappropriate sizing of the cuff can lead to erroneous readings, so proper fit is key to obtaining an accurate measurement. Once you have made your cuff selection, place the cuff on the patient's bare upper arm. Align the artery marker on the cuff to the brachial artery, as shown. Apply the cuff snugly, allowing room for no more than 2 fingers. Once the cuff is properly applied, check to make sure the patient is correctly positioned, and check the hose and cuff to ensure good connection. Ensure the blood pressure hose is not moving or swaying. The patient's upper arm should be at heart level. Their back should be supported, with legs uncrossed and feet flat on the floor. Ask the patient not to move and remain quiet during the reading. Conversation should not occur during measurement. Once the patient is fully situated and the cuff is applied, press the start button on the NIBP tile as shown. The cuff will inflate and take a measurement. The results will then appear on the NIBP tile located on the device screen. This now concludes the training video. For further questions around device use and operation, consult your Directions for Use manual or contact Welsh Alin Customer Care at 1-800-535-6663. Thank you for your time, and thank you for choosing Welsh Alin.